Welcome to Cancers 101. I'm your host Rittika, and today we are discussing an often overlooked topic in cancer care: bacterial infection in cancer patients. We'll talk about how weakened immunity, especially after chemotherapy, makes patients more vulnerable to bacterial infection. Joining me today is my fellow cancer research enthusiast, Aditi. Aditi, infections are a real threat for cancer patients, aren't they?
Absolutely, Ritika. When a patient undergoes cancer treatment like chemotherapy, their immune system gets suppressed, and this makes them more vulnerable to opportunistic bacterial infections. Bacteria that are typically harmless in healthy individuals can become life-threatening. Infections like Pseudomonas aeruginosa or Staphylococcus aureus are particularly common.
It's a bit like opening the door to pathogens that usually don't ever stand a chance. But it's not just about infections that occur right after treatments. Let's talk about neutropenia, where chemotherapy reduces the number of white blood cells. How does this make cancer patients more prone to bacterial infections?
That's right. Neutropenia is a significant concern after chemotherapy. Neutrophils, a type of white blood cells, are crucial for fighting bacterial infections. When chemotherapy decreases neutrophil counts, patients are left with a compromised defense against these harmful bacteria. Pseudomonas aeruginosa, for instance, can cause severe respiratory and bloodstream infections in neutropenic patients, leading to complications like sepsis. Similarly, Staphylococcus aureus can cause skin, respiratory, and bloodstream infections, all of which are very dangerous when the immune system is weak.
So it's like taking away the body's first line of defense. But beyond just the immediate infection, there's long term concerns too, right? Certain chronic bacterial infections like Helicobacter pylori can contribute to cancer development. Could you explain how?
Exactly. Chronic infections can set the stage for cancer. Helicobacter pylori is a perfect example. It's a bacterium that infects the stomach lining and it's known to increase the risk of gastric cancer. The infection causes chronic inflammation that damages the stomach lining, leading to mutations in the cells over time. This constant inflammation can impair the immune system's ability to detect cancer cells. In cancer patients with weakened immunity, H. pylori can more easily worsen the damage, potentially contributing to tumorigenesis.
So it's like an infection that acts as a silent accomplice, damaging tissues, promoting cancer. Now, looking at cancer care, we need to be proactive about preventing infections. Let's talk about the strategies like prophylactic antibiotics and microbiome modulation. How can these strategies help protect cancer patients?
Great question, Ritika. Prophylactic antibiotics are commonly used in cancer care to prevent infections, particularly following chemotherapy. These antibiotics help reduce the risk of bacterial infections like Pseudomonas and Staphylococcus. However, there is a catch. They need to be carefully prescribed to avoid antibiotic resistance. On the flip side, microbiome modulation is a newer approach. Since the microbiome plays such a crucial role in immune functions, maintaining a healthy balance of bacteria can support the body's ability to fight infections. Strategies like probiotics, dietary changes, and even experimental treatments like fecal microbiota transplants could help re establish a healthier microbiome and strengthen the immune response.
So it's not just about fighting infections directly, but strengthening the body's defenses by keeping the microbiome in balance. Aditi, considering these strategies, how important is it for oncologists to focus on infection risk when treating cancer patients?
It's incredibly important, Ritika. Infections can be just as dangerous as the cancer itself, and a proactive approach to managing infection risk can drastically improve patients' outcomes. From prescribing antibiotics to monitoring chronic infections like H. pylori, doctors need to take a more comprehensive approach to treatment. With the immune system already compromised by cancer treatments, focusing on infection prevention becomes a crucial part of cancer care.
So it's all about being vigilant in the face of these um big risks. To wrap things up, Aditi, what's one key takeaway for cancer patients and healthcare providers to remember when it comes to bacterial infections?
So, the key takeaway is that infection prevention should be integral to cancer care. Prophylactic measures, early detection of chronic infections, and efforts to support the immune system, like microbiome modulation, are critical for improving outcomes. It's not just about treating cancer, but also about preventing and managing the infections that come with it.
Absolutely. We must take the whole picture into account when caring for cancer patients. Thank you so much, Aditi, for sharing your insights today. And thank you to all of our listeners for tuning in. Make sure to subscribe, share, join us next time as we continue breaking down the signs of cancer. Until then, stay safe and healthy.